I would normally have already had an intake conversation. I've got some idea of history. I've got some idea of patterns. You know, when he notices it doesn't, blah, 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 right? All right, I might do a little bit of this. George,
so nice.
Is that so nice?
It is.
Okay, would you like me to continue, or should I just stop?
It's good. Keep going.
Okay, all right, so this is something that's like, all right, cool, you know, it's nice and simple. You can train somebody else to do this for you pretty easily, right? All right, if it starts becoming less comfortable, okay, and well, how hard am I working? No, I'm just not uncupping my hands. I'm just leaning back slightly. Okay, when I come out of it gently. Don't just drop the heels, right? All right, so why do I do that? Partly just it's a nice hello. Okay, maybe this is the first hands-on thing I've done with. Maybe I've already had him do some movement stuff. Okay, hopefully. Usually I will have done a little bit of movement stuff. Sometimes like he just gets up here and he's laying flat on his back. When somebody first lays on their back on your table, how often do they lay down perfectly straight? Yeah, he's all kinked up, right? They look like they're half in trip mode. So, what's a simple way to change that? Oh. As the legs come off the table, it's a little easier for the hips to align. Okay, so even if I don't keep them up here, this is a really easy way for me anyway, to help get things a little bit straighter. Okay, there's a lot of different ways you could spin off of that depending on how you're trained, and I'm not going to go into all those variations. What's a simple way that I can do a quick palpatory assessment? So an example of how I might proceed with a quick palpatory assessment is like, okay, so George, you've told me a little bit of, you've had some back and hip stuff in the past, okay? What I'm going to do is I'm just going to kind of press on some areas along your leg and your thigh and your hip and so forth, and I want you to let me know if you have any particular discomfort anywhere, anything like that, okay? Are your knees okay laying flat like this, or would you let me put a little pillow under those?
Those are perfect the way they are, surprisingly.
All right,
You have perfect knees.
Because maybe I want to bolster them quick, but, all right, so George, what I'm going to do is, as I come up along the side of your leg, any particular discomfort at all?
No.
Okay, and notice, nice, large, open, okay? I'm just looking for because I don't know if there's like a minefield waiting for me, right? Okay, it's not too bad along there, okay? So I might go just a little firmer, okay? Not too bad along here, yeah.
I was thinking.
I saw, okay, I was, you look like you're anticipating
Yeah,
something
right.
there. So you've had a little irritation here before?
Yeah.
Okay, a little foam rolling in your history?
Yeah.
Yeah, as we get down here close to the knee, it's a little
Yeah.
right in there, right?
Yeah.
Okay, so a couple inches above the knee laterally, right? It's like, okay, that's the nastiest thing we've found so far. All right, let me just kind of come up here. I'm just going to check around the knee.
Sorry, I forgot to shave today.
Oh, well, me too. So as I press up along in here,
You hadn't overslept.
all right, so I'm going to come up to around your hip bone. I'm just going to kind of go along the, not too tender or tickly. A little bit of right along in here.
Yeah, a little more
Little
right
bit.
there, yeah.
Okay, some medial aspect of ASIS. Okay, so as I come down below, it's a little bit more intense, or about the
Yeah,
same.
you're in the intensity right there.
Okay,
Yeah.
as I finish going around, not too bad as I go up. Okay, so medial aspect, okay, and slightly below the, okay, and you can feel that little bump that you sometimes feel right below the ischial ligament? No. Inguinal ligament,
right.
thank you. All right, so in inguinal ligament, what does that attach? Goes from where to where?
ASIS to the pubis, isn't it?
Yes, ASIS to pubis. Okay, so when you get below the inguinal ligament and you get east of the quadriceps femoris, rectus femoris, okay, where are you now? You're in the endangerment triangle, the Bermuda Triangle of the groin. Okay, and why? Nerves, blood vessels, all kinds of stuff, because Lord knows whatever else could be lurking in the, right?
Sea monsters.
So,
Ovaries.
ear bee dragons, okay? So we're gonna come down, rest of the quad, no big deal. All right, but there's a medial aspect to this quad. How many of you palpate the medial aspect of their quads? Okay, yeah, I see lots of hands going up, good. So, as I come up, no big deal, okay? So now, a lot of people, they'll stop at about this halfway point, okay? Not everybody does. However, this relationship is going to determine, and also what you can see, and your ability to understand where you are relative to the appropriate landmarks are all relevant to this, to how you proceed, right? So, you know, if I am not sure, okay? So with the male, I'm more likely to tilt the leg out a little bit, okay? And make sure that I'm following right along the skin, right along, okay, because he's actually got some adductors, right? So I'm not gonna come way off of those adductors because I don't need to bump into anything else, okay? So as I progress up the adductor, yeah, it gets pretty tender up there, right? And we're not all the way to the attachments, okay? And you know, and the chances are, if I kept going, it probably would continue to be tender, okay? So we've got a couple of options now, right? So a couple inches to the above the knee on the outside. This whole medial aspect of the ASIS and especially immediately below the inguinal ligament, and then up in here. Okay, we got a couple interesting things. Perfect. This covers everything. All the stuff I want to show you. I picked the right willing victim, except for one thing. This iliohypogastric deal. Okay, so if I often, if I'm working my way up, this is a quick thing. Because here I'm starting farther away and then I'm getting closer. It's like, okay, I'm going to come up here, just kind of check around your waist real quick. Okay, so I'm going to come up towards the ribs. ASIS, I've already was in here. That was no big deal. I'm going to palpate up towards the ribs. I'm going to come a little bit more laterally. Yeah, you can feel a little bit there. It's not your favorite. Okay, I'm going to come around back a little bit. Okay, yeah. So he's getting that little squinty thing. The other side, we're just going to jump to the other side here.
That's a little more tender on my left side.
Okay, so it's a little worse on the left than the right. And I haven't checked any of this other stuff. So, just for my own personal convenience, I'm gonna address the left first, and then I will address right here. And then whoever your partner is gonna have something to do no matter what side they're on. Okay, so right around midline, and in this case, if I pull the shirt down taut, the seam pretty much runs right along where it's at. Okay, if I go slightly posterior, not so much. If I go slightly anterior, it's still a bit there too. Okay, so how am I going to address this? What I'm going to do is we're going to slide this in. Okay. Now, if this is a shorter table than some here, okay, so some of you that are shorter, you may want to look to switch to working on a shorter table. Now, what I can do is what I would like to do is I'll squat down, I'll connect his legs to my body, use my legs and hips so I'm not using my back. I'll get my foot up here. Okay, so here he is. What's another option? I could put a chair here. I could put a chair here and then adjust the position of his legs. Now, I'm going to use a little rotation here. What am I going to do?
Nice.
Open that up a little bit, right? Okay. And now, add a little rotation of his body. Okay. So, pressing in here now. Anything?
It's like not even there.
Okay. Now the affected side, that foot is underneath. I might be at this position. I feel like I can stay here for a while, but maybe I want to add a little bit more to it, so now I can also use his foot. If I have Dyson on his foot, I can draw the skin down even more easily. Okay, and add just even slightly more. Feel okay?
Nice.
Okay, and I press in here.
It wasn't ticklish before, but it bordered ticklish. Now it's like it's not.
So we've de-tickled you.
Yeah, it's awesome.
Okay. So what I said yesterday, you will de-tickle some people. This is a really good way to de-tickle some people. Okay. So we can hang out here for a while, chat a little bit. Okay. Now, if I start feeling like, you know, maybe this is not a place I can stay as long. Okay. I mean, there's other ways I can position my body, depending on how I feel relative to position of his weight. So don't get locked into exactly like the pictures, because there's more than one way. But Diane is tiny, okay? So I know if she can do it, I know pretty much everybody here can do it. She's just had more practice, okay? And she might set the table lower or whatever, okay? And if not that, if you don't have your leg up, maybe you just marry this in, cross it, and maybe you just do more with that. Maybe you use both arms to support, but you know where to come down and check. Okay, I might, if I don't want to lose my monitor point, what's another simple strategy? Would you just put
Have
your
him
fingertip
hold
right there? You can. I forgot to mention that yesterday.
Active participation.
One of those things, right? Put that on a Facebook so everybody knows from now on. Okay. If you don't want to lose if you're afraid of losing your monitor point, have them mark it with their fingertip, and that way you can do anything you want to. Right? Okay? And then always come back right to it. Okay? So there's that one. Go ahead and slide that back out. Okay, again, coming out with a certain amount of control. That was a little, okay? I normally would come out a little smoother. Okay? Partly, not just because his body might like that a little bit better, but it also helps enforce the fact that I'm a knowledgeable professional. Right? How you do something can make that reinforce there or detract from that.
Didn't feel abrupt to me though, so
How's that?
much better.
Okay. All right. You hit enter on the thing there. Okay, so we've done some good stuff. You know, for this, we've settled this one down. So let's talk a little bit about some of this other stuff here. Okay. And I'm just going to proceed in the order that's there. Is this yours?
Yeah.
Yes. Okay. Cool. All right. So you can do this skin on skin. I do prefer to do some of this stuff with Dyson. And so let's talk about this ESIS stuff. I come along over here. Now I haven't done anything at all. Oh yeah. Oh yeah. Look at that. Look at his face. Let me drop an elbow in there. Yes. What are some of our other options? Well, here's one of them. Okay, I can drop my leg there. I can sit down. Okay, if I just scooch that over, is reasonably comfortable.
Oh yeah.
Okay, if I press in here now,
Little, but not as intense.
not as much, right? Okay, and if I was doing a strain counter strain, I would just position your leg differently, and it would pretty much be all gone. All right, but let's talk skin stretcher a little bit here. Okay, you got really slidey shorts, so
You
I'm
can
just
do
gonna.
skin too, Jason. I'm not bashful about
Yeah.
that.
I know. I'm glad you're not easily shamed, are you? When I press in here now,
It's nothing.
okay. So what am I doing? Just hook onto the skin. Just let it slide up towards the knee, away from that tender point. What can I do to add to the amount of skin stretch across the joint?
Anchor.
I know, she didn't have to use words, right? Okay, if you're not sure how to say it, you just move it, right? Perfect, beautiful, love it. Okay, so simple thing like that. Okay, can I still come down and monitor that? Yeah, probably. Okay, if I'm thoughtful about how I position my hand first, or maybe I just switch hands.
Yeah.
Okay. Okay.
Brilliant.
All right. So, again, simple concept, right? What if he has more pain when his hip is flexed?
Bring it down.
I don't flex the hip. And if he can't bolster under his knee, but it's not comfortable with his foot there, right? Okay, we can just make tons of little adjustments. Maybe this. Okay, so would you hit enter? Again, lengthening. Okay, no reason I can't gather. But how about this stuff over here? Okay, if he's up in here, it's still a little tender there, right?
Yeah.
Okay, so if I'm right here, but this stuff, not so much. Okay, this stuff, whew. Okay, So we can still get the funny faces, but no, I can keep his leg basically in the same position. But I'm just going to tilt it out. Maybe I'll even slide his foot slightly. Okay. And I'll just angle his leg differently. Now it's still, now the stretch instead of being locked on the skin more on the anterior aspect of his leg, now more of the inner aspect, right? And then drawing it instead of to the front, instead of drawing along the inside aspect of the knee, right?
You could drop an elbow now, I wouldn't feel it.
Seth? People's elbow. Okay. So, you know, another thing though, let's say I could just be here, right? I could just be here. If I was ready, I could scooch my hip back here. I want to add a little rotation. I want to add a little rotation this way. Okay, so again, we can, you know, it's like I don't even have to change my body position hardly at all, and I can get different angles of this. Okay, so it's all really goes by how their body is responding to what we're doing at the moment. There's probably a little bit there, but not what it was.
Not as intense, no way.
Enter. All right, so here's another one. Ventral cutaneous nerves, ventral front, belly side. Okay, again, here's the example where somebody might be reporting psoas pain. Okay, okay, yeah, he's just a little bit there, a little bit different. When I go more medial, where I was working before, not so much. I come out just a little bit.
Yeah, that's surprising because it didn't feel that way before.
Okay. So when we're looking at ASIS, okay, what attaches to ASIS that helps flex the hip? Rectus femoris. In the first phase of lifting the knee, it's actually much more powerful than the psoas itself. Psoas becomes more dominant like once we get to about 90 degrees and up. Okay? So when we talk hip flexors, we really need to consider rectus femoris as a primary hip flexor for so many things. Okay? So if this is still irritated here at the anterior aspect of the hip, okay, well, gosh, I guess I can do a couple of different things. You know, this area gets blamed for a lot of different things, but what if I, you know, I could just stretch the hip, stretch that. Another aspect is I can just draw the skin down. I can even come above the hip and gather it just gather the skin this way. Okay. If my hand is still able to reach. Okay. So I'm just many different ways of applying the same concept. Concept, a million applications. Would you hit enter again, please? Oh, okay, good. So forget that for now. We're not going to get to pelvic floor in this round. The other thing is that if he's a little tender over here, I could also apply balloon technique, right? I could go to the inner thigh and then gather the skin away that direction. We'll give it a few seconds here. Anything else? And that's better too. So which one is best? I'm going to leave that between you and your partner. Okay. Any questions about